Thank you. Ladies and gentlemen, and also friends from the press, thank you so much. Thank you for coming here at this press briefing. I would like to take this opportunity to reiterate the following points. Number one is that I would like to give you a briefing on the conditions of Zimbabwean nationals and Zimbabwean students in China. They are safe and sound and well taken good care of. Just this morning, I had a telephone conversation with the Minister Counselor of Zimbabwe in Zimbabwean Embassy in China, and I was briefed that he hasn't received any reports or any complaints for Zimbabwean nationals and Zimbabwean students in China. And we have also have hotlines, and that those people will, through the hotlines, just handle and deal with the concerns of Zimbabwean nationals and students in China. And I also checked with some parents in Zimbabwe that have kids in China, and they have nothing to complain. And so I want to assure you that they stay in China, they are good and sound, they will be good taken care of. Don't worry about this. And with the leadership of the Chinese Communist Party and President Xi Jinping, we will handle this issue and resolve this issue. Secondly, I would like to reiterate that the situation is under control. The outbreak broke out last December. Since then, the General Secretary of Chinese Communist Party and President Xi Jinping and also Premier Li Keqiang all go to the front line and give orders, give instructions, and mobilize the different departments of the ministries and also the different departments, the governments at all the levels in China. They are all working all the day, 7 days, 24 hours to fight against the virus. Now, in the epicenter of the virus, of the outbreak in Wuhan, and several hospitals are under construction. Now 2 have been completed within just around 10 days, and more than 2,400 beds are added to the facilities. More than 6,000 Chinese doctors and nurses and medical workers are deployed in Wuhan. And so we could say that we have the instruction, we have the leadership, and we have the capacity to deal with this issue. And also, we have done everything to ensure that the people's life will remain normal, and we organize the transportation of food, vegetables, all the daily necessities to Wuhan every day and to the affected regions. So I want to assure you, don't worry about it, and we will handle this issue efficiently and effectively. The situation is under control, and we will resolve this issue very soon. I would like to share the figures with you. Now the confirmed cases is around 24,000, and now more than 1,200 people have been cured and discharged from the hospital. And we also have now, unfortunately, we have around 600 deaths. Every life is precious to us, and we will try our best to contain the spread of the virus and to resolve this issue. Thirdly, I want to reiterate is that here in Zimbabwe, the Chinese embassy is also mobilizing the resources, every department, and the Chinese associations, enterprises, and we have already taken a lot of actions to stop the spread of virus to Zimbabwe, and we will try our best to do it. Number one is that we have already set up a team, task force, composing comprising of different departments, and also the enterprises, the Chinese diplomats, and also the medical teams. Secondly, we have already sent out the consular notices to the Chinese community and to the Chinese nationals in China. We say we discourage, we ask them to stop from coming to Zimbabwe for the time being, for the sake of the health and security of the Zimbabwean people. And we also say that we ask them, if some Chinese nationals come to Zimbabwe now, they have to be self-quarantined for 14 days. And possibly in the coming days in the future, then we could also ask them to increase the time, the duration to 21 days. We will follow the guidance of the Ministry of Health of Zimbabwe. And certainly we are also having a very close communication with the Ministry of Health, and we try to work out every measure to contain the situation, to keep the situation under control, to ensure the safety and security of the people here. And we also will help enhance the capacity of the government and also the hospital here to deal with any issue if that arises. At last, I want to take this opportunity to once again to express our gratitude to the Zimbabwean government and the Zimbabwean leadership for your support and for your assistance, and also express our gratitude to the people especially. And you are always together with us when we are in difficulty. And we believe that with the strong leadership of the two countries and with the efforts of the people, that we will resolve this issue and we will win the victory in the fight against the coronavirus outbreak. At last, I would like to thank you again. Thank you. I hear you. And now, according to the experiences, according to the scientists, of medical science, and the best way to deal with this issue, like the coronavirus outbreak, is that we put the people in isolation or ask the people to be self-quarantined and not to move and not to go to the public, not to go to gatherings. Then after 14 days or 21 days, and if the people are healthy and then they are good and sound, and if the people are infected with the disease, then they will show the symptoms. Then we can identify them. Then they can be sent to the hospital. So this is the best way that we deal with this issue in China, and this is also well recognized by the medical scientists and also WHO, and also been tested by our experiences in China and also around the world. So we will continue to do this. Certainly some students want to move and want to go back home. I believe that it is dangerous, and also the scientists also believe it is dangerous. So when you go, if they come back to Zimbabwe, they have to take the train, take the bus, or take the plane, and it is very dangerous because in a very closed space. Give you one example. Just a few weeks ago, Japanese government evacuated their nationals from Wuhan city, the epicenter of the disease, and hundreds of them arrived in Japan, but the infection has been greatly increased. So if they don't move, and there would be less infections, but if they move in group, and there would be more infections. So this is an example, and I want to assure you that this is the best way that we put them in quarantine, self-quarantine, and certainly then we have also make arrangements for some nationals of some foreign countries to evacuate, to leave China. And so this is our advice, that they better stay in the place where they are. And if they really want to move, really want to go back home, I think that the government of China and also the government of Zimbabwe could also assist then after the consultation and make the necessary arrangements. Certainly they can leave the country, they can leave the place, and we respect the will and also the plan and idea of the individuals, of the Zimbabwean nationals in China. We will assist. Thank you.
Maybe just to add on that, the issue of the assistance.
And I think that if you ask this question, that will come to the technical details. And so if they have any questions, so we can discuss that, the technicalities and all those details. And yeah. So what question do we have?
Well, maybe the best thing would be, you find out where there are any problems and be able to assist. I think that is really what he wants to hear from you. Where there is need for assistance by the Zimbabwean students, it must be forwarded, to the Chinese government.
They can forward to the embassy, and then, or they can also call the government departments then to raise their concerns. They will be assisted.
And also for you to assure him that from this meeting you're going to get in touch with China and voice this concern. I think that's what he wants to hear. And so that, immediately, like you indicated to us, that, you are guaranteeing their safety. You will be guaranteeing their safety in that fashion, that you will immediately get in touch, with your head office and advise them of this particular problem so that it can be solved. That's what we want to achieve.
Okay.
Yeah.
Okay. Thank you.
So
any other questions?
you will do that.
Okay.
Thank you for bringing up that question.
Okay. The figure I got yesterday, 28,000 confirmed cases